And that when you're around those household members who are leaving the house, wear a mask and ask other people to do that as well. More information on everything I've discussed here, as well as our statistics, is at www.phila.gov/COVID. Thanks.
Thank you, Dr. Farley. Now Armando will provide the Spanish language translations of the mayor's, Dr. Haight's, and Dr. Farley's comments.
Palabras del alcalde Jim Kenney para hoy, martes 7 de julio del 2020. Buenas tardes. Hoy nos complace contar con la presencia del Dr. William Haight, superintendente del Distrito Escolar de Filadelfia. Durante la pandemia, el Dr. Haight y su equipo, así como cientos de directores, maestros y el personal del distrito, han estado trabajando arduamente buscando formas de educar mejor a nuestros niños dada la pandemia del COVID-19. El Dr. Haight tiene los resultados de una encuesta que realizó el Distrito Escolar de Filadelfia sobre su reapertura segura este otoño. Además, él hará un anuncio importante sobre algunas reuniones virtuales en las que el público podrá participar para aclarar sus dudas. Estoy seguro de que a finales de este mes, el Distrito Escolar anunciará un plan de reapertura que satisfaga las necesidades educativas de nuestros niños en medio de estas difíciles circunstancias. Quiero agradecerles a todos los que participaron en la encuesta y a quienes están trabajando tanto para hacer posibles los ayuntamientos virtuales. Si usted está buscando qué puede hacer para ayudar, aquí le sugiero algo muy sencillo. Use una máscara. Mientras más pronto desaparezca la amenaza de este virus, nuestros hijos podrán regresar a las aulas más rápidamente. Por el bien de nuestros niños, es necesario usar las máscaras, porque los necesitamos en la escuela y porque para lograrlo tenemos que reducir el riesgo que representa este virus. Use una máscara. Todos podemos hacer nuestra parte.
832 or 51% are in nursing home residents. Now, so far, the week that ended last Saturday.
Los casos continúan aumentando a nivel nacional y también en Pensilvania. En Filadelfia, el reporte de casos se encuentra estable desde la semana pasada. Se han reportado 91 nuevos casos con un total de 26.901 casos acumulados actualmente. En promedio, hemos tenido 110 casos diarios durante la última semana. En las últimas 4 semanas, los casos aumentaron en personas menores de 40 años, se estabilizaron en las personas entre los 19 y 40 años de edad y disminuyeron entre los mayores de 50 años. Los menores de 40 años de edad que contraen este virus normalmente no se enferman gravemente, pero los jóvenes sí les transmiten el virus a los mayores. Hoy, felizmente, no reportamos fallecimientos. El total acumulado de muertes por la COVID-19 es de 1,617.
28% of the 12,000
distancing guidelines. We will be, that is, virtually, to adhere to social distancing guidelines. We will begin our briefing today with opening remarks from Mayor Kenney. Mayor, you have the floor.
Thanks, Mike. Good afternoon. Excuse me. Today, we're pleased to be joined by Dr. William Haight, Superintendent of the Philadelphia School District. Throughout this pandemic, Dr. Haight and his leadership team, as well as hundreds of staff, principals, and teachers have been working hard to determine how they can best educate our children despite COVID-19. Dr. Haight has the results of the district survey about how they can safely reopen this fall. In addition, he has an important announcement about some virtual town halls that will allow members of the public to weigh in directly. With all that feedback in hand, I'm confident that the district will announce a reopening plan later this month that will go far toward meeting the educational needs of our children in the midst of these very difficult circumstances. I want to thank all those who took part in the survey and those who got involved in the town halls. If you are looking for what you can do to help, here is a simple ask. Please wear a mask. The sooner the threat of this virus is gone, the sooner our children can be back in the classroom 100% of the time. And so for the sake of our kids and for all of us, we need those masks worn. We need our kids in school and we need this virus wiped out. Everyone can do their part by wearing the mask. And with that, I turn things over to Dr. Haight.
Thanks, Mayor Kenney, and good afternoon, everyone. And as the mayor indicated, I want to first begin by thanking all of the staff members, teachers, administrators, central office staff for creating and working hard, very hard, to create a lot of information that will be considered as we begin making plans to come back to school. As the mayor indicated earlier, last week, the School District of Philadelphia shared results of our reopening survey, of which more than 36,000 parent and guardians, community members, staff, and students completed. Some of the key findings from the survey, which was open from June 15th through June 22nd, found that the top 3 safety measures respondents believe will help with the development of safe and effective reopening plan were mask wearing, some 30%, daily building cleaning, 14%, and hand washing sanitizing stations, another 14%. Additionally, the survey found that 47% of approximately 15,000 parents and guardians who completed the survey said they would send their children back to school under current circumstances, and 62% said they would send their children back with safety measures in place. 28% of the 12,334 school-based staff and 27% of parents and guardians said they would feel most comfortable if students return to school in shifts on alternate days of the week. Another 24% of school-based staff and 21% of parents and guardians said they would prefer students attend school daily, but in shifts. We're pleased with this level of engagement and still providing opportunities for our stakeholders to share their thoughts and feelings about what a return to school might look like. This morning, we kicked off, as Mayor Kenney indicated, a series of virtual town halls. There are 5 sessions offering the public an opportunity to get updates on our planning efforts for the 2020-2021 school year, and importantly, to provide additional feedback to inform final planning and decision-making. Led by our subject matter experts in the areas of health and safety, academic supports, school operations, and facilities management, these sessions will allow participants to learn more about our thinking on supporting health and safety in our schools as offices, cleaning practices and protocols, instructional design and digital learning plan, and school scheduling, and much, much more. In addition to the feedback we receive from our stakeholders, whether through this virtual town hall series or via the feedback form that can be found by visiting www.philasd.org/2020 school start, we will use the guidance and best practices recommended by public health experts, such as the Centers for Disease Control and Prevention, the Philadelphia Department of Public Health, and the Children's Hospital of Philadelphia to inform a plan for the upcoming school year that will support safe and healthy learning and work environments for every student and staff member. Our goal is to share a final plan next week in order to allow our staff and families to prepare for the start of a successful school year in the coming weeks. Again, we encourage everyone to visit www.philasd.org/2020 school start for updates and an opportunity to provide feedback. I want to thank the mayor and his team once again for providing us with this opportunity to share these updates. Thanks again, Mayor Kenney.
And thank you, Dr. Height. Now we will go to the Health Commissioner, Dr. Thomas.
Good afternoon. Case counts from the coronavirus continued to rise nationally and in Pennsylvania as a whole. Here in Philadelphia, our daily case counts in the past week have been stable, neither rising nor falling. So here are the numbers with the background. Cases since yesterday, we've identified our new 91 cases, bringing us to a total of 26,901 since the beginning of the epidemic here in Philadelphia. Now, the past week, we've averaged just a little more than 110 cases per day. That's the week that ended last Saturday, which is no significant change from the week before that. There have been changes, however, in the age group of people who have been infected. In the last 4 weeks, our cases are rising in people under the age of 40, are pretty much stable in people between the ages of 40 and 49, and are falling in people over the age of 50. Now, people over 50 are the ones who are most likely to be severely ill, so it's good that the case counts in that age group are decreasing. But we're still concerned that the younger people who may not themselves get severely ill can pass it on to older people, so we're going to need to watch the age range of people getting infected in the future closely. Since this time yesterday, we've identified 0 new deaths from the coronavirus. Our total since the beginning of the epidemic is 1,617, of which 832 or 51% are in nursing home residents. Now, so far, the last week, the week that ended last Saturday, there were only 4 deaths that we identified and 16 the week before. It's great to see those numbers as low as they are. There is a delay in reporting, so we do expect those numbers to rise a little bit. To put that in perspective, at the peak of the epidemic in mid-April, in 1 week, we had 246 deaths. So no death is acceptable. Every death is a tragedy. The fact that we're getting closer to 0 is a sign that we've made really a lot of progress so far in the epidemic. Now, other areas of the country are continuing to see very rapid growth of the epidemic. U.S. case counts are continuing to hit all-time highs, particularly severe in Florida and Arizona and Texas. In some cases, their daily case rates on a per capita basis are higher than they were in New York City at the peak of the epidemic in New York City. These are places that opened without enforcing safety precautions like masks, and I think they're paying the price for that. We're also seeing rapid growth in Southwest Pennsylvania, the Pittsburgh area. In Allegheny County, they're now reporting more than 150 cases per day. That's up from about 20 cases per day 2 weeks ago. In every region of Pennsylvania, it's showing increases. We're also seeing rapid growth of the epidemic in Delaware, which has seen nearly a doubling of their case rates in the past week. Now, we're not seeing that rapid increase here in Philadelphia yet. We want to keep it that way. That's why we responded as we have to try to prevent a second wave here. The things we're doing, just to remind you, include reminding businesses and activity managers of their responsibility to enforce everybody keeping a distance, and even more so, enforce everybody wearing masks. We can't be there, but other people are there who can enforce that. We do have an executive order requiring masks, and the governor has an executive order requiring masks. We will be launching a media campaign reminding everybody of the importance of masks on this Thursday. On Thursday, you'll hear more about that media campaign. We have put on pause the reopening of restaurants and bars to indoor dining here in Philadelphia. We are recommending that everyone who can work remotely continue to do so. And I would recommend that people avoid social events and going to restaurants and bars outside of Philadelphia where they are open for indoor dining. These are places where people are close together and they're not wearing masks. And to the extent that we can understand how this virus is being spread in other areas around us, that appears to be the case. It's these social events in restaurants and bars. Now, we know that we're not going to totally be able to eliminate this virus, and so we want to protect those people who are at most risk for severe infection. And so we are recommending that people who are medically vulnerable take extra precautions. And the basic idea here is stay home and try not to let COVID into the house. That means that other people who are in your household should also stay home as much as possible. And that when you're around those household members who are leaving the house, wear a mask and ask other people to do that as well. More information on everything I've discussed here, as well as our statistics, is at www.phila.gov/COVID. Thanks.
Thank you, Dr. Farley. Now Armando will provide the Spanish language translations of the mayor's, Dr. Haight's, and Dr. Farley's comments.
Palabras del alcalde Jim Kenney. Cada la está buscando se abrir cubierta facial, pero no será para el 12%. Formar la planificar un plan.
Is raised right now on a different topic. Please lower it, and we will try to get to you later. Please remember, of course, we have limited time, so only one representative from each media outlet is permitted to ask questions, and reporters are asked to limit their questions to 3 or fewer. As I said, we will do a second round of questions on other topics if time permits. For now, we will start off with Mitch Blocker of NBC 10.
Good afternoon, everybody. Dr. Farley, can you talk a little bit about your level of comfort with kids returning to school by taking the bus, by limiting the numbers in classrooms? What is your comfort level on the kinds of things that we normally would think of with a return to school?
Well, we know in general that children are less likely to become ill with this infection. It's a little less clear the likelihood to spread it to others. And so we're probably, there's less concern there would be with children and getting together than with adults getting together. Nonetheless, in any place where we have children getting together, we're going to have to put in place a variety of safety precautions. And we are working with the school district around safety precautions in the classroom, in buses, and other settings. We don't have all that information. They haven't presented their plan yet, but I can tell you that their plan will be there to try to make the risk be as small as possible. It will never be zero risk, but we will try to minimize that risk.
I'd love your thoughts and Dr. Haight's thoughts on this. First, Dr. Farley, you've said teenagers are driving the new spike in cases. Does grade or age make a difference when it comes to you deciding who returns to school and how often they might be able to attend in-person class?
I'll take that. So we are prioritizing, and we're prioritizing first by our most vulnerable children, and then by the children who really need to be in front of a teacher. And so those two groups then equal many of the children with special needs who, throughout the time that we were remote, did not have face-to-face learning. Many of the children who are English language learners who did not have face-to-face instruction, and some of our youngest children, like children in pre-K, kindergarten, and first grade. Those are the children that we're prioritizing to be in front of individuals, and then we're setting other plans for essentially everyone else. But those are categories of children that we would want to see on a more regular basis, if not every day. I'll add one group to that category, and those are children in career and technical education courses, because they have training components with materials that they can only get in person.
And one more question for you, sir. Can you talk a little bit about what teachers are telling you in terms of their comfort level in returning to class? We talked a little bit about adults versus children. I don't know what the average age of a school teacher is, or an adult in the Philadelphia School District, but what are they telling you in terms of their comfort?
Yeah, so we had survey responses from many of our teachers that were very consistent with the survey responses from a survey that was sent out from the PFT. And where the vast majority of those individuals want to make sure that the sanitation protocols are in place at schools, that masks are required, and then there are strict protocols for social distancing. But the vast majority of them also want to make sure that we are returning in a way that's safe for children, ensuring that there are options for those who are in vulnerable categories.
Thank you, gentlemen.
Dr. Farley, was there anything you wanted to add to any of that?
No, that's fine.
Very good. All right, and thank you, Mitch. We'll move on now to Yaima Crespo of Telemundo.
Hola, muy buenas tardes. Mi pregunta es para el doctor Farley. El gobernador de Nueva Jersey alertó de una alza en los contagios de coronavirus. Él dijo que era una señal temprana.
Informar la planificación
That we are
incluye acciones para que los individuos que vienen de lugares donde ha habido problema, pero todavía no incluye a Nueva Jersey, aunque incluya Delaware.
Y por último,